Well, a warm welcome to this talk. Now, I just wanted to play you a couple of short clips from two doctors that have kind of fallen between the cracks, really, because these really show local democracy in action. Now, in Montana, there's a bill, HB 371, and this is a bill to ban gene-based vaccines throughout the states. And Christine Drivdahl-Smith is a local physician who spoke in favour of this, talking about the COVID vaccines, the RSV vaccine for the elderly, that are mRNA based, and concern about the dozens that are in development. Let's listen to Dr. Drivdahl-Smith now. It's only about four minutes. Give her the time to explain herself, which she does very clearly.
My name is Christine Drivdahl-Smith. Drivdahl-Smith. I am a family physician in Miles City. I have no conflict of interest. I am a volunteer board member of the Montana Medical Freedom Alliance. Gene-based vaccines, or mRNA vaccines, are the most destructive and lethal medical products that have ever been used in human history. I am asking you to support this bill banning gene-based vaccines so that we can halt continued harm, disability, and death of our citizens. Gene-based vaccines include the COVID-19 shots, and there is one other RSV shot that was approved for this past year for older adults. There are ongoing trials for influenza and bird flu, and there are dozens more in development. The COVID shots were rolled out just over 4 years ago under Emergency Use Authorization, or EUA. This has been renewed multiple times. The last renewal was in December of 2024 and extended the EUA until 2029, which also extends the liability protections. Under EUA, the FDA may allow use of unapproved medical products, including experimental products. Further, the regulatory procedures do not apply to the EUA products, which explains why the FDA has not withdrawn these dangerous vaccines. By the end of 2024, there was over 38,000 deaths reported to the VAERS system, with a known underreporting factor of 31 to as much as 100. There are over 3,400 peer-reviewed studies in the medical literature describing injury from these vaccines, including cardiac arrest, myocarditis, blood clots, immune suppression, autoimmune disorders, cancers, neurological disorders, prion-induced disease, pregnancy harms, and miscarriage. Every highly vaccinated country has had a significant increase in all-cause mortality, a decrease in life expectancy, and a decrease in fertility. These vaccines do not prevent disease or transmission. In fact, the more shots one receives, the more likely they are to get COVID. Over a year ago, it was discovered that the COVID shots are contaminated with DNA. This has now been confirmed by multiple labs around the world. The amount exceeds the regulatory limits by as much as 400 times. The presence of this genetic material increases the risk of cancer in the recipient, and this foreign genetic material has now been found within dividing human cells in a petri dish and in colon cancer biopsies. These mRNA vaccines, like other gene therapy medical products, can be shed to others via blood, body fluids, excrement, and airborne exosomes. Studies have now confirmed that these products are shedding to others, and that those exposed via shedding can experience adverse reactions. As you can see, there are no benefits and only the potential for harm. And yet, 23% of Americans continue to receive boosters. The American College of OB-GYN continues to recommend COVID shots to pregnant patients. And the CDC has added the COVID shots to the pediatric vaccine schedule starting at 6 months of age. There have been ever-increasing calls for an immediate ban by professional groups all across the globe. 5 states' attorneys general have filed a suit against Pfizer for misrepresenting the effectiveness of the COVID shots. And just last week, Citizens filed a petition
1 minute.
with the FDA to remove these products because the DNA contamination was not revealed to the regulators. The drug companies, the regulators, the federal government have failed to act. We all know that the hands of justice move slowly. Time is of the essence. I've spent over half of my medical career in emergency medicine. And during a trauma code, the most important thing is to stop the bleeding. So I'm asking all of you to use common sense and Montana let's get this done attitude. We must ban gene-based vaccines in Montana.
Well, an opinion from Montana. I don't think there's much to add to that. It's very clearly expressed. Thank you for that, Doctor. Now, there's another clip I want to play you, this time from the other side of the world. This is from Fremantle in Western Australia, and this follows a lot of local democratic movement from Port Hedland. And again, this is Dr. Sally Price expressing local concerns, but giving a voice through local democracy. Let's listen to Dr. Price now. Thank you.
Dr. Sally Price, 6162, medical doctor. Imagine this: a local restaurant causes a food poisoning outbreak. People are hospitalised, lives are lost. Or a bar serves adulterated drinks, killing its customers, like the recent tragedy in Laos. The reaction: outrage, investigations, headlines, immediate action. You'd avoid those places, warn your loved ones, demand accountability. That's what happens when lives are at stake. Now imagine this: people are walking unknowingly, unwittingly into medical facilities, rolling up their sleeves, as encouraged by the Frio Council, and unknowingly taking shots that, due to the previously detailed DNA contamination that we've already sent the Council, and its effects, for some are a death sentence, a game of Russian roulette, with outcomes ranging from sudden death. Sudden adult death syndrome is a new term to me after 35 years in practice, to cancer, strokes, infertility, or lifelong disability. The response: silence, not from you or me, but from those we trust to protect us. Why? Because facing this truth isn't safe or popular, but leadership isn't about comfort, it's about responsibility. For the unaware, let's clarify. In Port Hedland, a morgue 5 times the usual size had to be built to handle the surge in dead bodies. Newspapers now dedicate pages, not columns, to death notices. Excess deaths, as detailed, those above the expected average, have risen, varying between 9 and 24% in the last 4 years. These aren't just numbers. These are people, someone's child, someone's parent, someone's best friend. This council has a legal duty of care to protect the health and safety of its residents. It has a duty to mitigate foreseeable harm. These are not optional responsibilities. These are legal obligations. Ignoring them is a failure of governance, a dereliction of duty, and a betrayal of public trust. Council's legal duty, like other councils who have stepped up, is to protect the health and safety of its residents. Leaders in councils across Australia are stepping up. Why not here? Why not now? We are at a tipping point. Will this council choose to uphold its duty of care, or will it protect its image at the expense of lives? I ask you, not only as a qualified medical doctor, but as a fellow human being, to stand for truth, stand for action, and stand for the people you were elected to serve.
Well, I wanted to play those couple of clips expressing local concern because they are local and haven't got very wide publicity and distribution. Now, the Fremantle Council in Western Australia, I believe, passed the motions, and it's contacted higher authorities in Australia to escalate their concerns. Don't know what's happening in Montana yet. If you live in Montana, do feel free to update me. but the idea to ban gene-based vaccines throughout the whole state of Montana in that situation. Now, I was going to go on and talk about new research methods based on what Bobby Kennedy Jr. has been saying, but I think I'll leave that for now. We will be talking about that shortly. But I'll just leave you to reflect on what those two local doctors think. Let me know if you agree or disagree in the comments. But for now, thank you for watching.